बाकी एम्बेसी के स्टाफ को बुला लो। Sir, I'm just doing that, sir. सब लोग आगे सर I think so, sir. Good afternoon, everyone. I'm Dr. Vinod Gaikwad. I welcome all of you to today's program. As you all know, we inaugurated Namaste Kuwait, a week-long cultural festival of India yesterday in this auditorium. Today's event is another aspect of this multifaceted bilateral relationship between India and Kuwait, that is the presence of our huge and talented Indian professionals in Kuwait. Today we are going to focus on one of the major emergency practices which is needed for the safety of our lives when we are in difficulty physically. So that is called a CPR, cardiopulmonary resuscitation. So we are very fortunate here to welcome members of Indian Doctors Forum who are going to show us, practically demonstrate us that how to give the CPR to an injured person or the person who is in need. I welcome Ambassador of India to Kuwait, His Excellency Shri C.B. Josh sir and Madam Joyce C.B. to today's program. And with this, I would like to invite Dr. Amir Ahmed, President of IDF, to introduce the panelists today who are going to demonstrate us CPR.
Thank you, Dr. Vinod Gaikwad Saab. Honorable Ambassador Shri C.B. George, Madam Joyce, respected officers at the Embassy of India, ladies and gentlemen, Assalamu alaikum, good afternoon, namaskar. The other day, Honorable Ambassador called me and he said, Doctor, we want a workshop on CPR. A hands-on training on CPR. His Excellency continues to astonish, amaze us. I don't know, he is here as a diplomat trying to improve bilateral relationship. But then he doesn't leave any aspect that would remotely touch us go unattended. CPR or cardiopulmonary resuscitation. We are having a workshop. There is going to be an hands-on training. And by the end of this 1.5 hour of event that we'll be having over here, all of you who have assembled over here will definitely go back feeling satisfied that you have been equipped with a new skill. It's a very important life skill. Just like driving, swimming, CPR too is a very, very important life skill. In fact, it is included in most of the student school curriculum. It is something that each one of us, any responsible citizen, should be familiar with CPR. For you never know when you would want to administer it. And that single act of yours could be a lifesaver. So it's very important, and I'm so happy that Honorable Ambassador has initiated this initiative. As far as the Indian Doctors Forum is concerned, we are always there at your service. We are there at the service of the embassy for the expats who are residing over here in Kuwait. And we are very happy to be associated with such a program. Today, to conduct this workshop, we have two very eminent members from our forum. Dr. Abhay Patwari. He is the former president of the Indian Doctors Forum. He is a consultant anesthetist. He is also the head of department, anesthesia at the Armed Force Hospital. He's been here for close to 30 years, and he's a very familiar figure, not only among our Indian Doctors Forum, but among the Indians who are residing here in Kuwait. And joining Dr. Abe is the dynamic Dr. Swati Narendra Dongre. Dr. Swati is relatively a new member in the Indian Doctors Forum. She's a senior anesthesiologist. She works at the Sabah Cardiac Center, which is attached to the Amiri Hospital. And what makes all of you so lucky is she's a certified trainer too. So all the anesthetists, they are very familiar with this procedure that they're going to show you, but you also have a certified trainer who's going to demonstrate and then get all of you to come down over here and practice that hands-on training skill. So with these very few words, once again, assuring Excellency the commitment of the Indian Doctors Forum, I hope each one of you enjoys and benefits from this workshop. Thank you.
Thank you, Dr. Amir, for this introduction. His Excellency Mr. C.B. George, Madam Joyce, members of the Indian Embassy in Kuwait, we thank you for giving us this opportunity to come here and to involve you in a workshop regarding cardiopulmonary resuscitation. Dr. Amir has taken a lot of my introduction, so main thing is, today we have gathered here to learn some very important life-saving medical skills that can help you save a life of a near and dear or some unknown person also. So, since it is a medical skill, you might ask why I need to learn it. Most importantly, because an accident can happen at any place, at home, at a swimming pool, in a restaurant, and it is only the person who is on the spot, the bystander, who can do something to save the life. Nowhere in this world, medical help can reach you within 10 minutes. And this 10 minutes can prove fatal to the victim of cardiopulmonary arrest. So let us understand that cardiopulmonary arrest is the diagnosis, and that is what the patient is suffering from, and cardiopulmonary resuscitation is the treatment to be applied to this. Now, cardiopulmonary resuscitation is of two kinds. The first kind is called basic life support, and the second kind is called advanced life support. Now, basic life support is something that anybody can do without any equipment, without any drugs. So that is why it has to be learned by ordinary citizens of any country. CPR is to be started for a person who is not showing any signs of life. So, what are signs of life? How do you know a person is alive? Because when you talk to him, when you ask him a question, he responds. So, response is a sign of life. So, if a person is unresponsive, he is not alive, probably. Okay? What is the second sign of life? It is breathing. So if a person is not breathing, he is not alive. And third sign of life is a beating heart. So if a heart is not beating, he is not alive. And if he is not alive, then he needs CPR. Can we have our slides, please? Next. All of you know that we need oxygen in order to survive. If we don't get oxygen, we will not survive. Now, where is this oxygen that we are getting from? This oxygen is here in the atmospheric air. But this oxygen is of no use to us. Every cell in our body needs to be supplied with oxygen. And this oxygen has to be transported from the air around us to every cell in our body. So, of course, we need a transport system. So, what is our transport system? When we take a breath in, this air flows from around us into our lungs. There it meets our blood. Oxygen gets transferred from the air into the blood. And then this blood is pumped by the heart all over the body. So heart and lung together comprise the transport system which is responsible for taking the oxygen from the atmospheric air and giving it to all parts of the body. So if anything goes wrong with the transport system, your cells will not receive oxygen. And once they not receive oxygen, they will start to die. And the cells which are most sensitive to this lack of oxygen are the brain cells. So the brain cells are the first to die. And the problem with the brain cells is once they are dead, they do not regenerate again. So our aim in instituting CPR is to prevent this death of the brain cells. And this can happen in as little a time as 3 to 5 minutes. So it is important that every bystander, every person in the society should know what to do in this circumstance. So in this workshop, we hope that you will learn the skills that will enable you. First, of course, treatment cannot be given without diagnosis. So you must first establish the diagnosis. So suppose you are sitting somewhere and a person collapses and falls on the ground. Here, 3 situations can happen. The person may be only unconscious, but his heart and breathing is okay. Second situation, he is unconscious and he is not breathing, but his heart is still beating. So he does not yet have a cardiac arrest. But if this breathing is not corrected, he will develop a cardiac arrest within the next few minutes. And the third situation is where the patient has had a cardiac pulmonary arrest. Everything is stopped. So 3 situations. So you have to recognize each of these 3 situations and then institute treatment accordingly. So your job, if a person collapses in front of you, is to recognize what is his problem, activate the emergency response system. As you know, in Kuwait, 112 is the emergency phone number. And then you perform CPR. Next. This we have already covered. Next one. So all of you know that our heart is situated inside our chest. Okay, it is surrounded on both sides by 2 lungs, and the heart is inside in the midline, slightly towards the left side. And it is a muscular pump which pumps blood all over the body. Okay? So 2 important things that you need to do is chest compressions and mouth-to-mouth breathing. So basic life support consists of whatever you can do yourself without the help of any equipment or drugs. Okay? Next. So this is the chain of survival. If a victim of cardiac arrest gets early activation of the emergency response system, high quality CPR, defibrillation, transport to the hospital, and post-cardiac care, if he finds all these responses quickly, then only he has a reasonably good chance of survival. According to statistics, out of hospital cardiac arrest survival is around 25%. Sometimes we say, if you are given a choice, choose a place where you want to have a cardiac arrest. The best place is inside the operation theater on the operation table, because you are there and everything available, everything needed is there. So you have a best chance of survival there. But outside, unless you get quality bystander CPR, you will not be able to survive. Next. Next. This one.
Good evening, everyone. So, as Dr. Abhay Patwari sir has said, that the chain of survival, this is the links which tell you that what are the important steps we have to take. So basically, in the chain of survival for the bystander, what is the most important is the early recognition of cardiac arrest. And once you recognize that this is a cardiac arrest, the most important thing for a bystander is for the activation of the emergency response system. And as already mentioned, in Kuwait, it is 112. Second thing is, once you know and you have activated the emergency response system, then you go ahead with the CPR. And this bystander CPR is very important because as early it is started, it will save the patient's life. So this bystander CPR is for you. The bystanders who are there can perform this CPR and save a life. The next thing is early defibrillation. If available and if we are aware of this defibrillation, we can definitely go ahead with it, but this is for the paramedics and the hospital staff, followed by the advanced care. And in 2020, the AHA has just added one new chain, that is the recovery chain. That is, the AHA wants the patient of a cardiac arrest to go home happily. So they have added one additional chain, that is the recovery chain. So now we have known that, okay, this patient has collapsed, this patient is not responding, this patient is not breathing, okay, this patient is collapsed. So now when to start the CPR? So the first thing is, whenever a patient is in front of you, first of all, the most important thing is check for your scene safety, that whether you are in a safe situation to save the patient, because unless you save yourself, you cannot save the other. So the most important thing is scene safety. Once you check that the scene is safe, then next thing is you tap on the shoulder of the victim and you ask, are you all right? Are you all right? If the patient is not responding, or patient may be responding, that depends on what is the situation. Next. So once you know you have tapped and the patient is not responding, so the next step is to check for his breathing and check for his pulse. So there is one mnemonic, that is a look, listen and feel. So you have to look at the chest of the patient to check for the breathing movements. Secondly, you have to listen. Simultaneously, you have to listen whether there are any groaning sounds or any sounds which the patient is making. And third, with your hand, you are feeling the pulse. So this is an important step. Look, listen and feel, because it will tell you what condition the patient is. Whether the patient is not responding but having pulse and respiration, not responding, having pulse but no respiration, not responding, no pulse and no respiration. So it can distinguish into three things. So therefore, look, listen and feel. Next. So once there is no response, there is no breathing, there is no pulse, you are you are calling for help. Whoever is nearby, just ask them to call for help, or yourself call 112. And the most important thing, start chest compressions. So this is CPR. Actually, we all know the ABC, we learn ABC, but the AHA has taught us CAB. The sequence is different. So what they have said, that they have given an emphasis on the compression. So what they say, that even before airway, even before breathing, compression will save patient's life. So they have given the sequence CAB, that is compression, airway and breathing. So compression is the most important thing. Next. Okay. So how should we continue?
So before you start compressions, the victim must be lying on a hard surface. It can be the floor or a bed with a hard wooden platform beneath the patient. it is really good if the patient is lying on the floor. So you have to kneel beside the patient. All of you will try on these mannequins the exact technique. You have to kneel beside the patient. Put your two hands in the middle between the two nipples on the sternum or the chest bone, the breastbone, and you have to compress at least 2.5 inches below, directly downwards, and allow the chest to rise. Chest is an elastic structure. So if you press and leave, the chest will rise again. Okay? The most important thing is to do it. Don't bother about numbers or place, but the place must be correct and the rate must be correct. So do it fast and hard. If you use the power of your hands, you will get tired very soon. So you must use your body weight. And no bending at the elbow, your shoulder perpendicular to the breastbone, and use your upper body weight to do this compression. And you have to do it at a rate of 100 per minute. It is really tiring, so hopefully somebody else will come within that time to relieve you of this job. So push hard and fast, compress at the rate of 100 to 120 minutes, depth of 2 inches, allow complete chest recoil and minimize interruptions in compressions. So compressions should continue non-stop. Next, please. Another important thing is when a person is lying unconscious on a flat surface in this position, his tongue falls back and obstructs his airway. So even if he is able to breathe, he cannot breathe because there is a mechanical obstruction at the throat. So if a patient has his own breathing, but he is in a supine position and cannot breathe, he is unconscious, you must turn the patient to the lateral side. Okay? So this will make the tongue fall away on the side and open the airway. Or you can do what is called as triple airway maneuver, or head tilt, chin lift, and jaw thrust. These three maneuvers will open the airway. Next, please. This is for mouth-to-mouth breathing. Because it has been seen that due to COVID, nobody wants to do mouth-to-mouth respiration because of infection. Then for unknown people, you may not like to do it. That is why they are giving less emphasis on mouth-to-mouth. People were inhibited. They were not doing anything because they don't want to give mouth-to-mouth respiration. So now that has been made secondary. You don't give mouth-to-mouth, at least do compressions. So you need to do 2 breaths for every 30 compressions if you are able to do it. Next. Okay, if luckily there are 2 people who are CPR trained, one can do the compressions, one can do the breathing, and after some time they can interchange with each other so that nobody gets exhausted. Important thing is not to count the numbers, but to do it as fast as possible. Next. Next. This is just a summary of what you will do. You have confirmed patient is unresponsive, not breathing, no pulse. You called for help, you started compressions, and if there are 2 people, you can give a mouth-to-mouth, or if only 1 person, then he can continue. Push hard and fast. Next. This is for children. Of course, children, you cannot use so much force, so you can use heel of 1 hand or 2 fingers to do this compression. Next. Okay, next. So as I said, make sure that the victim is on a flat surface. Many times in the hospital, the sponge mattress and the spring bed, whatever compressions you give, the patient goes down. It is not effective compression. So we generally in the hospital, we slide a hard board under the patient's chest when we have to do this CPR. Minimize interruptions. See that you don't interrupt these chest compressions. When you give a breath, see that the chest is rising and falling. This only indicates that the air has gone inside the lungs. Then AED stands for automatic electric defibrillator. This is one of the most definitive treatments. If you are trained or your organization has a defibrillator, I think a place like Indian Embassy should have a defibrillator. This can treat most of the cardiac arrests. Resume compressions and continue this until patient has a spontaneous pulse. Next.
So now CPR has been performed and you want to know whether your CPR is effective, whether it is helping the patient or no. So how you will know? So you will see that the patient who is unconscious may start responding a bit. Maybe you will see some movements. Secondly, you will see there will be some improvement in the color of the patient. Like you will see the patient who was blue or dusky before, now it's turning into red or pinkish because the circulation has started. So, and you have to also continuously keep checking that your CPR is effective. How you will know? That whenever you are giving the compressions, you have to keep a watch on what is the rate of what you are giving compressions and what is the depth you are giving compressions. Because that will tell you that you are providing high quality CPR or no. And also when you are giving a respiration, you have to make sure that the chest is rising. So these all things will tell that yes, okay, we are giving a high quality CPR and it is helping the patient and we are going to get some good outcome. So now CPR is ongoing. Now there is a question that how long you will continue the CPR. So the question is when to stop the CPR. So when you see the patient is moving, now you can feel the pulse or the patient starts breathing, you see some signs of life. So that is the time when you can stop doing CPR. Also, there is like when there is a situation when you are continuing CPR, the patient is still not in, there is no still response, but the emergency team has arrived. So that moment, as a bystander, you can stop CPR and you can hand over it to the emergency medical team. Also, if there is any doctor under whose guidance or either telephonically or in the presence when you are doing the CPR, if the physician mentions you that this is the time you need to stop the CPR, you can stop the CPR. And also, there is a condition when you are giving CPR and as now when you perform, you will know that how exhausting it is. Definitely it is very exhausting. And when you are saving a life, your all adrenaline rush is there, you will get exhausted for sure. So when you are too much exhausted that it is going to affect yourself, or if there is any environmental hazard nearby that like you are giving CPR near a falling building or a building which is on fire. So that is a time when you also have to think about your safety. So that is why we have mentioned this thing, because as long as we save ourselves, we can save many lives. So the last condition where we think that the CPR should be stopped when either you are too exhausted to continue the resuscitation or there are any environmental hazards which are endangering your safety, and when the continued resuscitation which is putting the other people also at the risk.
This is what I mentioned before, that if the patient is unconscious but breathing, so you should not put the person in a flat supine position, but we should put it in left lateral position with the right leg folded like this so that the patient doesn't roll over. Next, please. Most common cause is the obstruction by the tongue, but it can be by a food bolus, foreign body, anything inside the mouth can block your breathing. So when you actually inspect the airway, if there is anything visible inside, you should take it out. Food is the other most common foreign object that can cause airway obstruction. Next. Now this is another emergency called choking. Most commonly happens in restaurants where people try to eat and take a big bite and they are not able to swallow. Now this big chunk of food blocks the airway and the patient cannot breathe. So if you are a bystander, for this person, CPR is the last treatment. There is one treatment that can be given before this patient will need CPR. This patient will not be able to breathe, he will start shaking, he will try to speak, but he is not able to speak. So you think that this patient has a airway obstruction due to choking. So there is one maneuver that you can perform to save this life. Next. Next. This one. Yeah. This is what maneuver? Heimlich. This maneuver was described by one doctor called Heimlich maneuver. It's called a Heimlich maneuver. Main thing is, if the person is able to stand, still not unconscious, you have to grip him from behind with your hand here, just at the xiphisternum, and then give a very powerful upward and inward thrust. This creates a very high pressure in his chest, and this bolus is like, this food bolus is likely to be thrown out. But if this person, you cannot relieve his obstruction, gradually he will become unconscious, he will fall down, gradually his breathing will stop and his heart will stop. So then he will need full-time CPR. There are some special situations in obese or pregnant persons. In pregnant persons, they should not be kept in flat lying down position. You should insert some wedge under the right hip so that the person is slightly tilted to the left side. Next. This is the same Heimlich maneuver which I said. This is how you perform. Look for signs of choking. Place your fist with the thumb side against the patient's abdomen just above the navel. Grasp the fist with your other hand and press into the abdomen with quick and inward thrusts and upward thrusts. Next. Okay. Thank you so much. This was just for the background. Now we will practice in groups of 10. Thank you.
Thank you. Before we start the practical demonstration, I would like to invite His Excellency Ambassador C.B. Joss sir to present a memento to both the doctors and Dr. Amir Ahmed also. After this, we will go offline. This is visible. After this, we will go offline. Okay. Thank you, sir.
Let us show once.
We will show one demonstration online also, and after that we can discontinue the our live streaming. Okay. Please go ahead. Thank you.
No, this is better.
It can be seen, no? Go ahead. See, what our esteemed anesthesiologist told just now to us. First thing is, you see a victim. You see a victim who's unconscious. First thing that you will do is, make sure of your safety. Make sure. You see an unconscious person, first thing that you do is ensure safety. Ensure safety of that person and ensure your own safety before you do anything. So when you approach and you know that you sit down, bend down, then first thing that you do is look for response. What did they say? Shake the shoulder. Are you okay? Are you okay? Person is not responding. Person is not responding. What do you do next? Look, listen, feel. Look, listen and feel. We don't know, the patient is probably unconscious. Is he breathing? Is there any circulation? This is what we got to look. So look, listen and feel. So what do? You keep your ear close to the nose and you keep your eyes on the chest wall. So you do this. So you're looking at the chest wall, whether it is moving. You're listening for any breath. And then you do the feeling for the pulse. So normally what we feel for is the carotid pulse. So here now, person is not breathing, person is not responding, and there's no pulse. So what's the next step that you'll do? Activate the emergency. Activate the emergency, 112. That's right. Activate, call out, or call out for help. If you have this thing, somebody responds, or you call out. So that's very important. And then what do you do? Yeah. Initially, I think it used to be airway, breathing, and then circulation. Yeah. But now, as Dr. Swati mentioned, American Heart Association is saying compression is the key. Compression is the key. So for compressing, what do you compress? You compress the heart so that the heart can have that circulation. For that, Dr. Abe said something very important. What do? You make sure that the person is lying on a flat, hard surface. So on the floor, or if on the bed, then put some plank or something. So why? Because below it will be hard and above will be your hand. So you are compressing the heart in between. So it will have an effective compression. And that compression interlock your fingers for an effective compression. Then place your hand, placement of the palm. Where will you place? Between the two nipples, on the sternum. And then, see, my elbows are locked. My shoulder is also locked. The entire force is coming from my body. I'm not doing like this. I'm not doing this. This is not the right way. Elbows are locked, shoulder is this, and the pressure has to come from the body. You're hearing that click sound. That shows that it is an effective compression. About 2 inches. Normally you do how many compressions, they said, before you give the breath? 30 compressions. And then, to give the breath, what do? Yeah, there are 3 ways of keeping the airway open. One is head tilt and tilting the head and lifting the chin. And you open up the stick and then keep your mouth enclosing and pinch the nostril and then mouth over there and give the breath. Then again go back and do the same thing. If there are 2, one will be on the taking care of the breathing, the other one will be doing this. And you keep continuing to do this till you get exhausted or till help comes in. Yeah. So I think we can all come here in 3 groups.
Because of the hesitancy in giving mouth-to-mouth breathing, they are now popularizing a technique called as COLS, which is called as compressions only life support. So this can be done by anyone without any hesitancy.
And you should remember, as Dr. Abe and Dr. Swati mentioned, it could be you who's protecting the life of a person. It can happen anywhere, anytime. And the time is important, the response time. Within a minute, if you're giving this compression, you are re-establishing the circulation to the brain. So the recovery period, everything improves.
Is it because of a block, doctor, it happens?
No, there's no circulation.
No,
And
is it
oxygen,
because of a block in the heart?
No, cardiac arrest could be due to various reasons.
Okay.
Cardiopulmonary arrest is the final step before
But
system. It could be because of a MI, it could be because of any issue.
so basically you are trying to have oxygen in the heart.
Oxygen
No,
will
no,
supply to the
blood.
entire body.
Oxygen is transported all over the body by hemoglobin in your blood. And only if this blood circulates all over, the oxygen reaches. When the blood reaches the cell, cell will take its oxygen. But you have to get the oxygen inside the blood. Heart is only a pump. But if pump fails, there is no circulation.
So you are trying to activate the heart.
Correct.
Second.
Not
is there-
activate.
Ensuring circulation.
We are
Is there
trying
anything,
to.
if you don't have anybody and you know you are going to have a heart
Yes,
attack?
this
Yeah,
is, sorry, we forgot to mention this. If you are driving and you have a heart attack, you have chest pain and and you think that you are going to arrest, the only way, you know CPR very well, but you cannot give it to yourself. So the only thing is very fast, deep coughing. If you cough vigorously, you can start driving towards the hospital and cough vigorously, you can increase the pressure inside your chest and continue circulation sometimes.
You won't be able to do.
No, you will fall unconscious now, you will not be able to take it.
Chest thumbs were recommended earlier, but they have taken out because that is not
Healthy.
healthy.
Absolutely, but in that case, if you have a defibrillator to choose, just in case, those can be used by the person.
Defibrillator usage is only once you are sure that there is no breathing and there is no pulse.
What is so the self
Defibrillator is a machine that, sir,
Cardiac arrest is of two types. One is called as ventricular fibrillation, in which the heart muscle is not contracting as a whole, but it is just quivering like this. So there is no effective mechanical cardiac output. And 90% of the cardiac arrests are because of ventricular fibrillation. And ventricular fibrillation is a disturbance in the electrical activity of the heart. So defibrillator is a device that can provide a shock to the heart. Now once you apply a defibrillator, an electric current passes through the heart and it stops all this quivering. And after this, the heart will start pumping normally. So defibrillator works in 90% of the cases because ventricular fibrillation is the most common type of cardiac arrest. For asystole, where the heart is at a standstill, it is not quivering, but the shock will not happen. So only continued CPR and advanced cardiac life support will help a person with asystole. So if a defibrillator is a small machine with two paddles, you just place these paddles on the chest and give a shock.
Battery operated.
This is battery operated, but it needs the AC to charge. It should always be charged because the shock will work only by DC current.
and what Dr. Abe was saying, you should have an automatic.
Automatic electrical defibrillator, it actually prompts you what to do.
It's there in
Like it is in airports, every organization. Sorry, mine. Oh, sorry. I am thinking voice is very loud, but. Sorry.
I think, so we will move into
Yeah.
three groups.
Okay, hello.